Good evening. I'm psychiatrist Jay Fulver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here in the Fort Wayne area by dialing 969-2720. Or if you're calling any place else, coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. If that's Matters of the Mind at wfwa.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fulver, can you tell by a person's facial expressions that they're having an episode of mental illness? I often note changes in facial expressions when my grandmother's dementia is particularly bad. Actually, you can tell by a person's facial expressions, especially if you know that person well. So if you're familiar with that person because they're a family member or a friend, yeah, facial expressions are modulated by the front part of the brain, which will also affect your emotions. So for instance, as your emotions grow more dark and dismal and depressed, you'll have a tendency to have a crease above your nasal bridge, and that vertical line will be there. It's called the omega sign, and the omega sign is an indication somebody's severely depressed. Not uncommonly, somebody's eyes will tip back a little bit when they get desperately depressed. That's called Veragouth's folds. So we'll look at somebody's facial expressions, especially if we know them well. You had mentioned you have a family member with dementia, and they will have changes in their facial expression based on their moods. That's not uncommon at all. And many people with dementia will have difficulty with not showing emotion, and that we call it a flat affect, where they just don't look happy, they don't look sad, they just kind of look blank. And we see that commonly with people, especially with Parkinson's disease associated with dementia. But when people have dementia, they have Parkinson's disease associated with dementia, many times they'll have a flattening of their facial expression where they have lack of facial expression in general. Now, some people, as they get older, when they have Botox injections in their face, you won't see that much difference in their facial expression because Botox by nature will paralyze the muscles, so it's sometimes difficult to really gauge how somebody's emotions are doing if they've had Botox in the past. But for a lot of people, you can tell a difference in how they're doing based on their facial expression, especially if you're very familiar with them. Thanks for your email. Let's go to our first caller. Hello, Jess. Welcome to Matters of the Mind. Jess, you want to know about mental health disorders, which ones disguise themselves as attention deficit hyperactivity disorder. ADHD, by definition, is a condition where somebody will have difficulty with focus, concentration, they're more distractible, they have difficulty with impulsivity, and if you just tell a doctor, I'm having trouble with distraction, I'm more impulsive, I'm not getting to sleep at night, a lot of clinicians might put two and two together and say, that's bipolar disorder, and they give you a mood stabilizer. A mood stabilizing medication like lithium or an anti-epileptic medication or an antipsychotic for that matter will often make ADHD symptoms worse. There's a big difference there, and you got to sort it out. With ADHD, it's a day-to-day phenomenon, and it goes back to when you're a kid. So more days than not, almost every day, you're always having trouble with attention span, concentration, focus. Now, you can keep your mind on things with ADHD if they're interesting, challenging, or new and exciting. But in general, you're having trouble with day-to-day nuances of being able to focus and concentrate. Bipolar disorder is quite different. With bipolar disorder, people have a few days in a row where they don't need to sleep. They'll be more impulsive just on those days. They'll talk really fast and go from topic to topic just on those days. And then if anything, they crash where they get really slowed down and they want to sleep all the time. They're not wanting to socially interact, and they have trouble concentrating on the low side as well. So bipolar disorder has to be differentiated from ADHD very, very carefully. We have another condition of hypothyroidism. People with low thyroid will often have symptoms that look like ADHD, and people will say, you know, they're in their mid-40s and they'll say, I've been having these ADHD symptoms just for the past 2 or 3 years. Well, that's not how ADHD works. ADHD has to be typically a lifelong phenomenon. It's more days than not throughout your entire life that affect you in different ways. But with hypothyroidism, when your thyroid's on the low side, you'll have trouble with concentration, focus, your skin will be dry, you might be more constipated, you notice that you have some difficulty with hair falling out. Those are all symptoms of low thyroid. Diabetes, similar type of thing. If your glucoses are high or low, that will give you difficulty with concentration. We go back to when it all started and try to sort things out from there. From a psychiatric standpoint, depression will sometimes give people difficulty with speed of processing of information. In other words, it's like their brain has slow internet speed, and we call it speed of processing with depression. But it's a classic symptom of depression, and many people will say, I have adult onset ADHD, when in fact they really have depression that started in the more recent years. Perhaps they will have difficulty with concentration. So when we hear about somebody having difficulty with concentration or attention span, we're trying to sort out, are there any medical problems? Are there any psychiatric problems? What kind of things might be contributing to those? ADHD is very classically there day by day by day, and it goes back to childhood. Many people can't remember details of their childhood, but if they can remember back to middle school or so, that's when a lot of those symptoms will have started. But as we get to be adults, we'll have different reasons for having difficulty with concentration. Sleep apnea, something else from a medical condition. If somebody is snoring or they're having difficulty with the exchange of airflow at night, such that they're getting decreased oxygen into the brain, decreased oxygen in the brain will give you difficulty with fatigue, concentration, sleepiness the next day. That will often give people symptoms like ADHD. So simply giving somebody a stimulant when they have ADHD symptoms is not the way to go. We need to sort out, like with any medical condition, what is the true etiology and the underlying problem that we need to treat. I always give the example, if you have chest pain, you need to sort out, is that chest pain from a heart attack? Is it from bronchitis? Is it from you're getting a peanut caught in the esophagus? Are you having gastric reflux? What's causing the chest pain? We need to sort that out, because our treatments are going to be entirely different, even though this chest pain from all those types of condition can feel similar. You can have a pulmonary embolus giving you a chest pain. So all these different conditions can give you symptoms of chest pain. In the same way, you can have symptoms of ADHD with poor attention span, distractibility, and impulsivity that can be related to other kind of conditions. It's very important we sort those out, Jess. Jess, thanks for your call. Let's go to our next caller. Hello, Sean. Welcome to Matters of Mind. Sean, you want to know about the importance of structure and activity for somebody with dementia. It can't be more critically stated, Sean, that when somebody has dementia, try to keep their environment and their activities around them very consistent and very much the same day by day, because people with dementia, they have trouble with short-term memory, and they need to have predictable consistency day by day by day. When you try to change that routine, it can be devastating for them. That's why many people with dementia, when they get medical conditions, as can happen as medical complications, they go into a psychiatric hospital, they go into a medical hospital, they go into a different environment, and they get very agitated to the point where they can get delirious. Delirium is where you forget where you are, you start to hallucinate, you see things and even hear things sometimes that aren't there. And people with delirium are very, very confused, and it's often because you've taken somebody from a previously familiar environment to a very unfamiliar environment. So structure, activity, sameness is great for people with dementia. It's nice to allow them to reminisce about their past, get photographs of their prior lives and people who are involved in their lives all around them, but try to get them in the same environment day by day by day. That's really one of the best things you can do for them to decrease the agitation that so commonly is associated with dementia. Sean, thanks for your call. Let's go to our next caller. Hello, Tom. Welcome to Matters of the Mind. Tom, you want to know, why are mental health emergency detentions for 72 hours? Tom, they are 72 hours of weekdays, so it gives a clinician 72 hours to evaluate them. If a patient comes in on a Thursday, they'll be there Thursday, Friday. The weekend doesn't count, so they'll be there until at least Monday. 72 hours arbitrarily has been determined to be a reasonable time to assess somebody's mental status. During that time, they often are not treated during those 72 hours unless they need to do so on an emergency basis due to agitation, aggression, or maybe the potential for harm to others. So they can be treated as needed during those 72 hours, but after the 72 hours, it's determined, well, Do they understand they need to be there voluntarily, or do you have to get a court order to keep them for a longer period of time, or can you release them after 72 hours because the crisis in which they were admitted has resolved? So 72 hours, a 3-day time period, is thought to be a reasonable time to be able to observe somebody's mental status to determine how they're doing. If it was just 24 hours, and there is something called a 24-hour hold where they come in, it's called an immediate detention. It's a very brief observational period. Often that's not long enough to really determine how somebody's doing. In 72 hours, if they're going to withdraw from any drugs or alcohol for that matter, you're going to notice it in that time period. But that's historically been the case for several decades now, Tom, where the 72-hour hold has been a means by which somebody can be involuntarily assessed, not necessarily treated, but involuntarily assessed in a psychiatric hospital. Tom, thanks for your call. Let's go to our next email question. We have another email there. It's Reed, Dear Dr. Favre, I'm thinking about giving up sugar. How does sugar affect the brain, and what kind of withdrawal symptoms can I expect? Well, it's interesting. Sugar can have an effect on your overall mental status, but there are no insulin receptors in the brain. So insulin doesn't affect the brain so much directly, but glucose can get right across the blood-brain barrier and affect the brain. So if you have fluctuations in your blood glucose where it's going up and down, okay, you can have difficulty with fatigue, poor concentration. If you give up sugar, yeah, you might notice you might have a little bit of withdrawal from it initially, not drastically if you give up sugar entirely. It's very difficult to give up all sugar because keep in mind, sugar is simply a combination of glucose and fructose. So you put that combination together, and you're going to see a lot of different means with fruit and even with vegetables for that matter. You're going to have a lot of carbohydrates out there. So I think what you're saying is that you'd like to give up carbohydrates and go on a low carbohydrate diet. So let's backtrack there. If you have a low carbohydrate diet, initially, not undoubtedly, you'll feel kind of tired. And you'll feel kind of weird, and you'll wonder that first week if you can get by with it. But as you hang in there on a low carbohydrate diet, it's an interesting phenomenon that I've observed with other people and myself for that matter. A low carbohydrate diet will often be more energizing for you. If you can keep your insulin levels suppressed by having a low carbohydrate diet, it actually is good for your mental health. So a low carbohydrate diet by suppressing insulin levels can in many cases actually help your mood and help your concentration. Difficult to do. You've also heard of it as being a ketogenic diet. An extreme form is a carnivore diet where you primarily eat meat, but a ketogenic diet is simply where you're trying to limit carbohydrates, and in doing so, the whole premise of doing so is to suppress the insulin. It's not the glucose that's dangerous to the body, it's the high insulin levels. The high insulin levels can be very toxic to much of the body, and the insulin will regulate how much glucose does get to the brain. So if you can suppress those peaks and valleys of glucose going up and down, you'll often notice you have better concentration and a better mood. Thanks for your email. Let's go to the next caller. Hello, Diane. Welcome to Matters of Mind. Diane, you'd mentioned since you've started Paxil, also known as Paroxetine, for your obsessive-compulsive disorder, you've noticed getting easily agitated with people. Why is this happening, and should you avoid crowds? Paxil, Diane, is a medication that does increase serotonin fairly potently, more potently than the other serotonin reuptake inhibitors, such as Lexapro, Zoloft, Prozac, Celexa. Those are all medications that will increase serotonin, Luvox being another one. Paxil is probably the most potent of all of them, but Paxil will have a breakdown product that can increase agitation for some people. So you can actually have more anxiety, especially as you go to a higher dosage with Paxil. So the breakdown product of Paxil can give you some difficulty with agitation and irritability. So in those cases, Diane, I'd recommend talking to your clinician about the possibility of possibly decreasing the dosage some, going to another serotonin medication other than Paxil. Paxil is a medication that has several drug interactions for one thing, so it could be another medication that you might be taking that could be problematic. But Paxil also is fairly notorious for causing people to be fatigued, for causing them to have weight gain, and also having horrific withdrawal if you miss a dosage or two. Missing a dosage or two with Paxil can give you zings and zaps in your hands and feet, give you a burning sensation in your scalp, make you more agitated. That's why Paxil does have a controlled release form where it kind of is a smoother release. But Paxil does have some liabilities, and one of them will be increasing agitation. I wouldn't consider that a good outcome for you, Diane. I'd want to go another direction if I was treating you with Paxil. So talk to your clinician about that. Diane, thanks for your call. Let's go to the next caller. Hello, Francis. Welcome to Matters of the Mind. Francis, you want to know, are there mental health exercises that can improve your memory and mental reflexes? I think what to what you're referring, Francis, is the importance of keeping your brain active. So as we go through life, we want to keep our brains active. So when we talk about something like retirement, I find it interesting. In the Hebrew language, there is no word for retirement. So as you get older, you shouldn't just quit working and quit socializing and quit getting out of the house because you hit that magic age of whatever you wanted to retire at, whichever magic age. You should keep yourself busy. And you should do so intellectually, socially. When people talk about mental exercises, they often perceive that they should do puzzles and different games. And there was a study involving a large group of nuns several decades ago, and it was found that these nuns lived to an older age and they had a lower risk of dementia compared to people that were living their age who were not nuns. And it was found that the nuns were very, very active doing puzzles and different intellectual and brain activities day by day by day, and they had less dementia. So that is a factor in helping somebody, but I think when it goes back to what happened with the nun study, it really looked at their keeping their minds active, and they were socializing, and we often overlook the importance of socializing. When people socialize, it actually helps the brain. So during the COVID pandemic, with all the lockdowns and all the social restrictions, it was devastating for so many people who already had pre-existing mental health issues because now they were socially isolated. And for young children and young adolescents who were at a critical age for learning social skills when they were restricted from going to school, many of them are having mental health consequences from those kind of decisions that were made at that time. They're having depression, they're having more difficulty with anxiety, especially in social situations. So it's extremely important through our lives. We have some kind of social network that we maintain. We keep our brains active with reading the news, keeping yourself active with puzzles if you have them available, but simply doing the New York Times crossword puzzle every day won't prevent you necessarily from getting dementia. You have to have a wide range of different intellectual activities that you maintain. So stay socially active, keep your brain active. Those are the main things you could do to help your brain over the course of the years. But very importantly, exercising, some kind of physical activity will affect this particular neurotransmitter called brain-derived neurotrophic factor, BDNF. And BDNF goes up when you're exercising, and you want to exercise on a regular basis. Exercising is like brain fertilizer. So socializing, keeping the brain active intellectually, and exercising, those are the main three things I could recommend. You know, you're wondering why I didn't mention nutrition, the importance of nutrition. It's okay, but it wouldn't be at the top of my list. Nutrition, you know, it helps to some degree with the brain functioning, but I don't think it helps as much as socialization, brain activity with intellectual exercises, and exercises. Those are the three main things that I think are even more important than nutrition at this point. Nutrition is good for everybody. You know, you shouldn't eat the refined foods. If it's out of a box or out of a bag, you should really limit that. Go easy on the carbohydrates, as I mentioned before. A ketogenic diet where you're basically eating a low carbohydrate diet, that's good for the brain, but it's not going to be as impactful as socializing, intellectual activities, and exercising for the brain long term. Thanks for the email. Let's go to the next caller. Hello, Will. Welcome to Mayor's the Mind. Well, you'd mentioned you're struggling with drinking alcohol too much, you're smoking cigarettes, and you're depressed. You don't know where to start. What should you do? When we look at somebody who's drinking alcohol, smoking cigarettes, and having depression, I'm often going to really focus first on trying to get you to back off the alcohol. Now, the first thing I'm going to ask you, Will, is why do you drink? Some people will drink alcohol as a means of helping them sleep. Some people will drink alcohol as a means of decreasing their anxiety. It chills them out. Some people drink alcohol because they feel happier when they're drinking alcohol. Now, why would you feel happier when you're drinking alcohol? It's a bad sign if you do feel happy if you're drinking alcohol. But alcohol, for some people, will go to this middle part of the brain called the nucleus accumbens. It's the happy joy center of the brain, and really fire that part of the brain up. If you notice with your first drink as an adolescent or a young adult that you felt really happy, you didn't feel just buzzed, you felt happy. That's a bad sign that later on you could have trouble with alcohol. So the first thing I'm going to do is try to sort out why you're drinking, and let's do something about backing off the alcohol. That's the first goal. Secondly, Second goal will probably be to do something about the depression itself, which quite frankly probably contributed to the drinking of alcohol anyway to some degree. So did the alcohol itself cause you to be depressed? More often than not, you're drinking alcohol because you feel more depressed without it. So we're probably going to give you an antidepressant medication. In the midst of all this, get you an alcohol or some kind of substance use rehabilitation, get you involved in counseling. But from a neurobiological standpoint, we're probably going to start with getting you off the alcohol, helping you with decreasing the depression. Smoking cigarettes, that's important, but I don't often recommend that somebody try to quit drinking and stop smoking at the same time. I know it's controversial. You'll have some clinicians, some counselors insist that you stop drinking and stop cigarettes all at the same time. It's a different neurochemistry of the brain. I wouldn't argue with them if they say they're successful with the approach of getting people to stop drinking and stop smoking at the same time. My preference is to stop drinking, which quite frankly has more dangers involved with it than smoking cigarettes. Smoking cigarettes is terrible for the physical health of the body, but drinking will get you involved in automobile accidents, give you more social disturbances with getting along with other people, give you extreme impairment with the mood and cognition, being able to think. So drinking alcohol, if I was to weigh their risk versus smoking cigarettes, I'd say, let's get you off the alcohol first. Now, smoking cigarettes, that might influence which antidepressant I give you, because some antidepressants like bupropion or Wellbutrin can be more likely to help you get off the cigarettes than others. So I'm going to look and see how much of an issue for you it will be the smoking and the cigarettes. If you're smoking more than 2 packs a day, we might give you a nicotine replacement of some type, a patch of gum, an inhaler, some type of nicotine replacement to get you off the cigarettes. But usually the cascade of treatment will be deal with the drinking of alcohol, help with the depression, then help with the smoking and the cigarettes. So start with your primary care clinician. We'll see what kind of suggestions he or she may have and then go from there. But I wish you the best, because all those conditions can be treatable. And for many people, once they've recovered from the drinking, the depression, and the smoking and cigarettes, they'll say they feel like they have a new brain because they can concentrate, they're actually calmer, and they sleep better. I mean, nicotine is terrible for sleep because nicotine wears off after a couple hours, and you wake up and you feel like you're going into nicotine withdrawal after a couple hours. So nicotine's terrible for the sleep, and not uncommonly people will drink alcohol as a means of helping them sleep because of the nicotine. So it's kind of a vicious cycle when it goes round and round. Well, thanks for your call. Let's go to our next email. Our next email reads, Dear Dr. Favre, I'm thinking about giving, I've already answered that one. I'm thinking about giving up sugar, so we've already talked about sugar. Do we have another email out there? There we do. Yes. Should a patient with mental illness set goals for themselves while they're doing therapy or taking medication? Does it help to have goals? Absolutely, positively. I believe strongly that everybody should have goals. As a matter of fact, when I first see a patient for initial assessment, I always ask, what are your main goals? If I could help you in 3 ways, what are your 3 top priorities? Because I need to know that as a clinician, because after talking to you and after you've completed all these questionnaires that I might give you, I want to know, okay, I've got some ideas on how I can help you, but I want to know what's important to you. And sometimes I might be surprised. So I want to know, from your perspective, what are your main goals for treatment? And many times with our questionnaires, we'll actually ask people, what are your goals for treatment? How would you want to feel better? If you could feel better this way, this way, and this way, how would you want to feel better? Secondly, we want to know what would prevent you from staying on a medication. Now, that sounds like a silly question, but the bottom line is some people will have minor side effects and they'll stay on a medication because they feel better. Other people will have any side effect of any kind and they'll go off the medication. So we want to know how tolerant you would be to any side effects, especially early on in the treatment. Many treatments will give you some side effects early on the first month or so, and they will often diminish over the course of time. Many people will insist they don't take a medication that might be addictive, a medication that might cause this or that problem because they would never take a medication that had those kind of side effects. So we want to know about that. We also want to know, when we see somebody initially, not only what your goals might be, what side effects you want to avoid, but we also want to know, when's the last time you felt really good for a month or 2? That's very important because I want to know how long you've been feeling lousy. It's going to be a more challenging treatment if you've been feeling lousy for years and years versus if it's just been a bad year for you for the past year. So we want to know what goals you have, what side effects you want to avoid, and when's the last time you really felt good for a whole month or 2. Those are all very important questions that your clinician should be asking you, and you should consider even before seeing a clinician for mental health treatment. Thanks for your email. Let's go to our last caller. Hello, Milton. Welcome to Matters of the Mind. Milton, you want to know if there's anything you can do to stop sleep paralysis and waking up feeling anxious and afraid what's happening during your sleep. Sleep paralysis, Milton, is occurring because when you're going into dream sleep, it's also known as rapid eye movement sleep. It affects the front part of the brain. It shuts down the front part of your brain. Rapid eye movement or dream sleep will paralyze the body. And that's a good thing because you don't want to be acting out and you don't want to be having what's called a sleep behavior disorder where you're punching and flailing your arms and you're running and jumping all around while you're sleeping. So your body naturally will go into a paralytic mode while you're sleeping. Here's what's happening, Milton. You're awakening while you're still dreaming and you can't move for a few seconds. Number one, I'd say don't worry about it because it is something that's not considered dangerous. It's kind of scary when you first experience it, but just remember to tell yourself, Milton, you've been dreaming and it's something that can happen while you're dreaming. Now, if sleep paralysis is occurring during the day, Milton, that's called narcolepsy with cataplexy. So people with narcolepsy with cataplexy, it's a whole other phenomenon where your brain goes into REM sleep, it goes into dream sleep when you're wide awake, and then you have paralysis and you can't move your arms and legs. So sort out, Milton, is it happening during the day? That's narcolepsy with cataplexy, or is it happening just at night? That's sleep paralysis. Milton, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. I'm psychiatrist Jay Faulver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.